Hi, my name is Michelle, and I'm a level 1 student nurse, and I was hoping if I could shadow you today.
Yeah, that's fine.
I was wondering if you could give me an SBAR report on your patient.
Sure. I have Mr. Ronald Jarvis. He is 67 years old. He is a full code. He has no allergies. He's in room 622. His doctor is Dr. Phillips. Mr. Jarvis is here. His primary diagnosis is stage 2 diabetic ulcer on his right heel. And his secondary diagnosis is diabetes type 1, which he's had for 20 years. Mr. Jarvis was at his primary's doctor's office complaining of sugar level readings over 300. He states that his pain level is a 1 from a scale of 1 to 10. Mr. Jarvis is alert and oriented times 3. He wears glasses, but he has no hearing problems, no hearing aids. His activity level at the moment is as tolerated. His speech and perla is clear. He's currently in room air with O2 readings in the high 90s. There's no cough present and his lungs are clear. He currently has no problems voiding. His bowel sounds are normal. His last readings of the vital signs were 128 over 70 for his blood pressure, 96% oxygen level at room air. His heart rate is 76 and 98.4 oral temperature. His last AccuCheck reading was done at 2030 and it was 242. All his labs are within normal limits, and right now he is due for 2 insulins, which we'll be giving at the same time, but we'll be giving separately. One of them is Lantus, and the other one is the regular insulin, which will be given following a sliding scale.
Okay. Why specifically is this client receiving the medication, and what action does the medication have on the body?
Mr. Jarvis is receiving the medication because he's a type 1 diabetic and his body is no longer able to produce any insulin. The action that the medication has on the body is that the insulin helps cells to take in glucose to be used for energy.
Okay. When should you question administering this medication?
If his sugar level is too low, we will hold the medication to prevent any adverse effects.
Okay, and what vital signs must be monitored, and what physiological parameters should be monitored when the medication is being administered?
We need to always check all vital signs, especially his glucose level, which need to be checked every 8 hours per the doctor's orders.
Okay. What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting and at home?
We need to make sure that his vital signs readings are good, especially his glucose level, since in his case we'll be administering insulin. We also need to make sure the dosage of the medication is correct, as well as we have the right patient. We need to make sure we use clean needles. We need to make sure we're changing injection sites.
Okay. So what are the side effects and potential adverse reactions?
Some of the side effects would be the patient to go in a hypoglycemic state, and the worst one would be putting the patient in an anaphylactic shock.
And how do you know the medication is effective?
We need to make sure the patient takes the insulin with his meals and monitor his glucose level as ordered.
Okay. Thank you.
So now we're going to go into Mr. Jarvis's room.
Okay.
My neck. I'll wash my hands. Hello, Mr. Jarvis. I'm Sophia. I'm going to be your nurse for today. I have Michelle with me that's a nursing student. Is that okay?
Yes.
Okay. Mr. Jarvis, you are due for your insulin right now, and you are due for the regular insulin and the Lantus. Do you have any questions about it right now?
No, I don't think so.
Okay. So now I'm gonna go to the computer
Okay.
and double check what he has ordered. I'm gonna ask Mr. Jarvis, do you have any allergies?
Nope, no allergies.
Okay. So I'm gonna go ahead and scan his armband.
Okay.
Scan it. Make sure I have put him up here in the MAR, and I do. I have Mr. Ronald Jarvis, and he says he has no allergies, and on the chart it says he has no allergies.
Mhm.
Once I scanned, we won't be able to see it, but his number is 953-655-296. I have it in the computer. I'm going into my MAR, so I'm gonna check my order.
Okay.
So as you can see, we have the green lights here. So he is due for his Lantus, and he is due for the regular insulin.
Mhm.
I'm gonna make sure we have the right dosage of the medication. We are gonna give it at the right time.
Mhm.
We also are gonna verify if it's correct with pharmacy and the doctor's order. We also, we can also have a drug guy with us, and I have verified what is the correct route and the correct way of giving the insulin.
Okay.
So, and that's that. So over here, so we have 2 green lights, so that's what he is due for. I'm gonna go ahead and scan. And I'm gonna go ahead and pull my medication from the Pyxis.
Okay.
I have my medication pulled from the Pyxis here already. And now that I have my medication pulled, I'm gonna double check that I have the correct medications with me again. I'm also gonna check the bottles, make sure there's no cracks. Make sure that expiration date, make sure the solution looks the way it should look. I would like, in order to teach you, I want you to see that we have the right medications here,
Okay.
and we have the right dosage, and we're gonna give it at the correct time. We have the correct patient, and again that he has no allergies.
Okay.
So now I'm gonna go back in to prepare my medication. I'm gonna go ahead and wipe my hands again. I'm gonna put on my gloves.
Okay. So it's gonna be 500 here, 100 here.
And according to the MAR, regular insulin is given with a sliding scale. Mr. Jarvis's last sugar level was 242, so he will be getting 16 units of the regular insulin,
Okay.
and he is due for 18 units of the land.
Okay.
So we all already scanned both. We have the right everything. So now we're gonna prepare. We're gonna go ahead and start with our regular first. We're gonna wipe our bottle. We're gonna go ahead and dispose. Gonna pull 16 units of air first. Okay?
Mhm.
Our bottle is clean. Go ahead. Push in air.
Well, it's not air, it's not.
Pull our medication. 16 units. Okay. I'm gonna go ahead and recap with one hand. It doesn't have to be recapped all the way.
Okay.
And now we're gonna put our 18 units of the Lantus. We're gonna wipe our bottle always. Dispose. We're gonna use a different needle.
I get confused.
And this is too, this here, you see that, it's too much.
And we're gonna put our 18 units of air. Our bottle is clean. Push our air in.
You always wanna
Pull our
look,
medication.
you
Make
don't
sure
come
there's
in
no
and just stare at the
bubbles.
machine. Yeah, you wanna look and make sure it's set right, but you also wanna make
Recap
sure you
with
see the dripping over here
one
where it's
hand
supposed to,
again.
especially if you have a couple.
Okay.
You wanna make sure it's
So now that our medication is ready,
and you wanna look
we
inside.
can
And you look like you have a leak.
go ahead and go back to Mr. Jarvis. Mr. Jarvis, your medications are ready. I have your regular
So you
insulin
have to look
and
at all
your
your connections and
lenses.
make sure they're all tight.
I know earlier you mentioned that you would like to know about the cardiac diet that you have been put on by your doctor.
Yes, I do.
And I have a pamphlet here, and you can look it over. I know you've mentioned before that your vision has decreased, and if you have any difficulties reading the wording of it, I can go ahead and get you one that has bigger letters. That way it's easier for you to read.
Okay.
This also shows the options of what you can choose for your meals. I'm going to leave it here. I'm going to let you read it when you get a chance, and if you have any questions, you can press your call button and call me, and I will come and answer you. Also, we can call in a consult for a dietitian to come and speak with you if you have any questions, since you will follow this diet at home as well.
Okay. That sounds good. Thank you.
All right. So now I will give you insulin. I will be giving it in two different parts of his abdomen. We don't want to do it in the same place.
Mhm.
So, Mr. Jarvis, where was the last time you had your injection?
I had them both on my left side.
You had them both on your
Mhm.
left side. So we're gonna do them on the right side this time, if that's okay.
Mhm.
We're gonna do one in your lower and one on your upper. Is that okay?
Yes, that's perfect.
Okay. So now we always wipe that injection site. At the same time, while you're wiping, you can observe if he has any redness, any soreness, any openings.
Mhm.
We wait for that to dry. We have our medication.
Because that's usually like a gram or
Here's the regular insulin first. We squeeze. 90-degree angle, we push.
we're going through it now.
Okay? This goes in the needle box. Always dispose needles in the needle box. And then the next one we also wipe. We wait for that to dry. We have our next insulin. We squeeze, 90-degree angle. There you go.
Thank you.
This goes in the needle.
Okay, you had the arrow up.
Any discomfort, any pain, anything?
No, I feel good.
Okay. Well, I will be back for you to see if you have any questions in regards to the menu and the cardiac diet. I will leave your caller with you, which is here. And he is on a little forest, so I put the bed alarm on.
Okay.
You're not there yet.
Please press your call light if you have any questions. Okay?
Okay. Thank you.
So now that we have administered our medication, just throw my gloves.
Well, milligrams
Wash
per
my
kilogram
hands
didn't
again.
work out too good for you.
Now we would go to MR, and we need to document everything we did with the patient.
Okay.
So we need to document that we have assessed our patient.
Mhm.
We have the last glucose reading. We need to make sure that what we've given, how much we've given, where we've given the injections, how the patient tolerated the injection. We also need to document what teaching we provided, how we provided it, if the patient had any difficulties reading the pamphlet,
Mhm.
if we put any consults for dietitian. So over here, we we click on the green light. For example, with the Lantus,
Mm-hmm.
as administered, we would scan and put in the patient ID since it would already be up, and we would save it. We would save all our work
Okay.
and double check everything we have charted.
Okay.
Mhm.
Thank you.
Do you have any questions, Michelle?
Yes. Were there any pertinent pieces of information you reviewed before administering the medication?
Yes, we need to assess the patient always, and we need to make sure we have his last reading of glucose level.
Okay. Did this information affect your decision to administer the medication?
Yes, because if the sugar level would have been too low, we would have to have the medication.
Okay. And did the information affect how you administered the medication?
Yeah, like we always need to check the injection site. We need to make sure the patient doesn't have any redness, any soreness, and we always need to make sure we teach the patient as well that he needs to switch his injection sites since he is giving himself insulin at home as well.
Okay. Alrighty. Thank you.
Thank you.
Mm-hmm.